This video demonstrates the proper patient setup for a 24-hour ambulatory blood pressure monitoring study with the SunTech Oscar II. Before you begin, be sure the patient understands the Oscar II is a medical device, not a home BP monitor. It should be worn for the duration of the study, both while awake and asleep. To begin, place the Oscar II into the provided pouch as shown. Be sure to zip the pouch closed with the air hose exiting from the top. A belt loop on the rear of the pouch allows the patient to wear the device without interfering with normal activity. Be sure the Oscar II monitor is securely fixed to the patient before proceeding. Next, check the patient's upper arm circumference to determine the appropriate size cuff to use for the study. The index marker should fit into the range indicator. If it does not, choose the appropriate larger or smaller size cuff. Once the appropriate size cuff is selected, slide the patient's arm through the stretch sleeve. This patented feature is designed to keep the cuff properly placed over the brachial artery through the duration of the study. Place the artery marker or arrow directly over the brachial artery and wrap the cuff snugly around the arm. Next, connect the air hose from the Oscar II to the cuff. A proper connection is made by twisting the connectors in place and hearing a click securing the hoses together. If there is slack in the hose, adjust it so the patient is comfortable. Make sure the hose is not kinked or folded to avoid blocking inflation of the cuff. Before testing, be sure to take at least one reading to verify proper setup. Turn the monitor on by pressing the start-stop key. Wait for the display and then press the start-stop key to take the first reading. This will begin the study. Inform the patient that during a reading, they should stop what they are doing. If safe to do so, let their arm hang motionless away from their body and avoid talking. During the inflation, check the hose and connections to be sure there are no blockages or leaks. When the reading is completed, the result appears on the display of the Oscar II. Even if you program the monitor to disable the display, the results will still appear for the first 20 minutes so you can verify proper functioning. Once the hookup is complete, the patient may put loose, non-constrictive clothing over the cuff and hose. If a patient would rather wear the Oscar II on a shoulder strap instead of the belt, there are two clips on the rear of the pouch and an adjustable shoulder strap included with your Oscar II system.